here, as you can see, the behavior analysts supervise the programs and directly provide ABA services to the students. They work in confluence with the parents, the caregivers, with the staff. They provide the classroom teachers, the other therapists with behavior intervention plans to ensure that problem behaviors are reduced, with tips for skill acquisition. But what I'd like to speak in greater detail is the special program that was conceptualized and developed at the center. This is the Parent and Child Training Program that Nilima is a part of. This is, we call it PACT, for children with autism, and it follows the principles of applied behavior analysis. Started in 2006, PACT, a time-bound program lasting 9 months, is based on the premise that training the trainer, in this case the parent, positively impacts quality of life of individuals with autism by utilizing scientifically validated and effective intervention. Training the parent, equipping them with the required skills, and thus empowering them yields better outcomes than providing education for the child alone, and results in lasting benefits for both the children and the parents. Some of our students from the first few batches of PACT and who have continued in Al-Noor since are now ready to join the workforce. Coming back to today's topic, this seeks to address something many of us have seen and have been a part of: escalation of problem behaviors. We all know that implementing proactive and sometimes reactive strategies greatly contribute to creating a safe environment, helping in lowering barriers to learning, and thereby enhances social participation and facilitates inclusion. We hope that today's webinar will give you a better insight into what is involved in reversing escalation and terminating crisis as quickly as possible. It will also emphasize that determining the function of behavior through a functional behavior assessment and implementing effective behavior intervention plans across settings and people can not only resolve current situations, but also reduce the future likelihood of behavior crisis. With this, I leave you in the capable hands of my colleagues, Nilima and Michael. Nilima and Michael, both BCABAs, both from the Department of Behavior Analysis at Al-Noor, have worked on skill acquisition and problem behavior reduction for students with ASD here. Today, they'll share with you their expertise, the vast expertise, I should say, and experiences in successful de-escalation of problem behaviors. Over to you, Michael.
Hello, everyone. And I would like to welcome everyone once again to this wonderful training. I am Michael Abarca, and I'm one of the behavior analysts that Ranjin and Stephen has mentioned a while ago. And I'm here today to discuss about challenging behaviors and give a quick introduction on applied behavior analysis, or ABA. Okay. Nilima, can you please move the slide?
Yeah.
Yeah, thank you. So when we are talking about challenging behaviors, we are looking at behaviors that we can measure. These are the behaviors that the naked eye can see. If we are able to measure and define objectively a specific problem behavior, then we are also able to analyze it and use it as a platform to teach sets of skills, to create behavior intervention plans, and to monitor the progress of the behavior of concern. That is why when we look at challenging behaviors, we have to abandon mentalistic or subjective ideas such as problem behaviors occur because the child is bad home situation, poor parenting, due to disability, or due to previous trauma. Yeah, we all have different definitions of these concepts. one might define the word bad differently from the other person. So these ideas do not account to the true cause why the problem behavior is occurring. Next slide, please. Okay, sorry. Challenging behaviors occur because the behavior produces a desired outcome for the students. A student may, sorry, Milima, can we go back? A student may cry because he wants the mom's attention, or another student may bang his head against the wall to escape a certain demand or a difficult task. So at the end of the day, there is a desired outcome they want to get out of it. Next one, please. Okay, working in this field for less than a decade now, I have witnessed various problem behaviors or challenging behaviors. I have seen a lot of aggressive behaviors such as hitting, kicking, screaming. What else? We can think a lot of things. We can think of poking others' eyes, as severe as that. I have also seen a lot of self-injurious behaviors, such as picking their own skin, pressing their eyes constantly, or forcing to vomit. So those are just examples. I have also witnessed stereotypical behaviors. These are the behaviors that occur that are not in context. So it could be in the form of production of vocalizations or body movements. So an example of it would be excessive laughing, even there's nothing funny, or just flapping the hands. Yeah. But these are just topographies of behaviors. There is more to problem behaviors than just topography. And when we will look at it in depth, that is what we are talking about today. So what do we know about problem behavior? Problem behaviors are learned in the same manner as appropriate behaviors. These problem behaviors are learned according to how they are reinforced or rewarded in the past. Student A may learn how to cry to access water, while student B may use his words or request properly when he needs access to water. They may express the need for water differently, but they learn according to how they were reinforced in the past. These behaviors interfere with learning, most especially when these behaviors arise during academic or structured activities. Also, it interferes social interaction. Their peers might observe their behaviors and may look at it as something weird, which may impact on how they interact with that certain student. And definitely, some of the problem behaviors can be harmful. If a problem behavior is occurring, it is being supported in the environment where it is occurring. So there might be parents who would come to you and report to you that, hey, my daughter is presenting these problem behaviors, where in fact, as a teacher, you might not be able to observe it in the classroom. It's because these behaviors might be supported or might be reinforced or rewarded at home and might not be in the school. That's why it's happening at home and not in the school. So it's very important that we execute our interventions consistently across settings, because it's going to play a vital role in the progress of the behavior. Next one, problem behaviors serve a function for the child. So these functions may be whether they want to access attention, they want to access a reinforcing item or a reward, they would like to escape a difficult task, or even just to engage in self-stimulation. And lastly, we work on reducing these problem behaviors and teach appropriate behaviors that serve the same function. So more than reducing the problem behaviors, it's very important that we work on replacing these problem behaviors that serve the same function. What happens is that if we just work on reducing the problem behaviors, then and without working on replacing that behavior into something socially significant, they might find another topography of the behavior, and this behavior will keep occurring. So it's very important that rather than just decreasing any problem behavior, we need to look at replacement behaviors as well. And how we do that, next slide, please. Yeah. So applied behavior analysis is something that we can use, and it's a methodology we widely use here in Noor Training Center. In Noor. So what is applied behavior analysis? Applied behavior analysis is the science of systematically applying interventions based upon the principles of behavior to improve socially significant behaviors to a meaningful degree. So I know it's a huge chunk of information, so let's try to dismantle the terms there. So we have mentioned that applied behavior analysis, or ABA, is a science because ABA is data-based. We rely on data. We don't assume, we don't guess, or we don't surmise when we do ABA. We make sure that our intervention is the one in charge or the one responsible for the behavior change. Okay, we have also mentioned that in ABA, we systematically apply interventions based upon the principles of behavior. So we have a system on how we assess the student. We have a system on how we assess the function or the cause of why the problem behavior is happening. We also have a system on how to create behavior reduction plans or IEPs or goals, target skills for the student. At the same time, we also have a system for monitoring the progress of the student based upon the principles of the behavior, namely reinforcement, punishment, motivation, extinction, and stimulus control. So I know this sounds jargon to you, but I wouldn't go into depth for the principles of behavior because we will need another set of training just to discuss the principles of behavior. We have also mentioned that ABA looks at improving the socially significant behaviors to a meaningful degree. When we say socially significant, these are the skills or behaviors that is important to our client and not to other person. Okay, so the parents might want the student to learn mathematics, where in fact the student cannot request for basic wants and needs yet. Hence, we might not prioritize academics, but we'll work on requesting for food, requesting for water, or requesting for reinforcers or rewards. Next slide, please. Okay, so one of the biggest part or vital part of ABA or in reducing problem behaviors would be divulging the function of the behavior. When I say function of the behavior, we're looking at the cause why the challenging behavior or problem behavior is occurring. So we only have 4 things to remember. which is escape, attention, tangible, and automatic reinforcement. When we say escape, these are behaviors mediated by the removal of a difficult task or a demand. So these are behaviors that being presented when they want to escape a certain demand. While for attention, these are behaviors mediated by access to attention. Tangible is when they want something, they want a reinforcing item or a preferred activity, so they present problem behaviors. And lastly would be automatic. These are behaviors that are mediated when these students want to engage in sensory stimulation. So whenever we look at problem behavior or challenging behaviors, the first thing that needs to pop up in our mind would be, why is this challenging behavior occurring? So now we can only look at 4 things. You could maybe think about whether the student is escaping, or maybe this student wants my attention, or the like, tangible or automatic reinforcement. Next slide, please. How do we identify the function of the behavior? So we have different assessments on how we could identify or rule out the function of the behavior or why the behavior is occurring. One of it is indirect assessment. These are assessments wherein we get secondhand information from teachers and parents through interviews. We also have descriptive assessments. Examples are ABC charts. When I say ABC, this is what we call the 3-term contingency, or we call ABC as antecedent, behavior, and consequence. That is why we call it 3-term contingency. So we're looking at observing or narrating what the behavior and what happens immediately before the behavior and after the behavior has occurred. That is why it's called ABC. We also have classroom observations. And lastly, we have functional analysis, wherein we identify the functional relationships through manipulation of suspected controlling variables. Okay, so if we suspect that the problem behavior is mediated by attention, we give so much attention to the child and we look at the data points, whether it's increasing or decreasing. So we try to manipulate one variable and we rely on data whether it gives us a functional relationship between the two. Therefore, it could lead us to a more credible outcome, or ruling out whether the problem behavior is caused by attention, by escape, or by tangible, or by sensory or automatic reinforcement. Okay. These assessment tools provide important inputs that help us in identifying the probable function of the problem behaviors and controlling variables present in the environment. So now that you are all acquainted well enough when it comes to not only the topographies of behavior, but at the same time, we have seen challenging behavior or problem behavior in depth. And we have also identified one effective and research-based methodology in reducing problem behaviors. Then we are now able to look at interventions or strategies on how to de-escalate the problem behaviors. So I am turning the floor to my colleague, Nilima.
Yeah, hi everyone. So as Michael said, now that we have the function of the problem behavior identified, Next is to work on the function. Now, as he said, Michael said that the function of the behavior is the most important data that we need to have in order to develop strategies, because if we work on the function, then many topographies of the same function can get reduced. So it is very, very important that we know why the behavior is occurring, rather than actually what the student is doing. The why of the behavior is the most important factor than the what of the behavior, because we have to work on the why of the behavior. So at Al-Noor Center, what we strongly believe, and what behavior analysis has trained us to do, is focus a lot on the proactive strategies, so that we are able to reduce the occurrence of problem behavior in the first place, rather than once the problem behavior has occurred, then we try to do damage control. So we focus a lot on proactive strategies to reduce the problem behavior. And the first part of any proactive strategy is, if you want to change somebody else's behavior, we first have to change our behavior. That is the first part of any strategy. So in case you are looking for a behavior change in your student, your child, or whoever you are working with, then you will have to first change your behavior, so that you are able to bring about a behavior change in the expected behavior change in the student, or the client which you are working with. Also, we have to always focus on a lot of antecedent strategies uh, to reduce the occurrence of the problem behavior. And in case many of our antecedent strategies have not been so successful in actually reducing the frequency or the duration or the occurrence of the problem behavior, that is when we actually devise a behavior intervention plan, and then discuss it with our teams, so that we are able to work on the reduction of the problem behavior. Now, what are the ways, or what are these proactive strategies that we can use? So as I said, we have to first focus on changing the environment, if it is possible. And these are a few ways in which we can change the environment. Many of you must be aware of these points that I have noted. So visual schedules. Many of our students with autism have a lot of language deficits. So it is important that we are able to tell them in a way in which they understand. So visual schedules go in a great way in you know providing information to the student on actually what is going to happen at that time, because visual input is for many of our students easy to understand. So visual schedule is a definite strategy which you can bring about in your environment, so that the student is aware of what is going to happen one after the other, the way in which things are going to move. Also, arranging the room where the student is working, or where your child is actually going to spend time, in a certain way, so as to reduce occurrence of problem behavior, is a definitely recommended strategy. There are many ways of arranging room, and a lot of will depend upon the specific problem behavior that the student or the client is engaging in. But there are various, most of the times what we can do is reduce visual stimuli. Many of our students have difficulty when there is excess stimulus around them. So reducing visual stimuli and making the environment simple and straight always helps. Modifying the seating to an extent. If we have a student who is constantly, let's say, trying to bolt from the classroom, and if we are able to move that student a little away from the door, then it will help us to actually have some time in place, so that we are able to block that behavior, or reduce the occurrence of that behavior. Having accessible communication devices is the I can't stress on it more, because most of the problem behaviors that are occurring are because of the communication deficits that our students with autism have. And whatever communication modality that we have chosen for our student or client, it may be PECs, it may be any speech generating devices or apps like Sonoflex or something that we are using, or the vocal communication that the student uses, that has to be accessible at all times, wherever the student or the child is moving. Many a times we see that parents many a times say that we had gone out and we didn't have the device with us, or the teacher says no, the device was left in another room and we were in a different room. So I think all of us as a team have to make an effort that we the communication is a part of the student's body, and it has to go where the student goes. It's like carrying your words wherever you are going, because when we go, our words go with us. So it is very important that students communication modalities go with the student wherever the student is going. The last point here is appropriate leisure activities, where I think all of us need leisure in our life. All of us have some way of relaxing ourselves, and we need to work on developing these activities in our students. And whatever is that leisure activity that the student finds doing is likes to do, I think it has to be made available in the classrooms, at homes, or wherever, whichever setting that the student is involved. I think all of us, if it is in place, then we have brought about a remarkable change in the environment if we are able to do that. Apart from changing the environment, we can also bring about a lot of change in our daily routines. The basic is that in classrooms or in at homes or wherever the student or the client is working, many a times the client is expected to sit down, or a student is expected to sit down. So as behavior analysts, what we do is that we always recommend evaluating sit time to playtime ratio. In a sense, how much do you expect your student to sit, how many minutes, how many if the student is sitting only for 2 minutes right now, it is not right of us to expect that the student starts 20 minutes straight away. So we have to work gradually on evaluating or increasing this ratio. So here at the center, what we do is that we have something called as sitting span data, wherein we take a baseline of the student. If the student is sitting, let's say, for 1 minute with X, Y, Z reinforcers, we slowly increase that sitting span to 2 minutes, 3 minutes, 4 minutes, and so on and so forth. So it is very important that we evaluate this sit time and playtime ratio. Circle time, again, for many of our students, working in a group is a challenge. It is easier for them to work one on one, and when others are involved, peers are involved, it is quite challenging for our students. The same thing can be done for the circle time length. We have to alter the circle time length or increase it gradually. We cannot go from 5 minutes directly to 15 minutes or 20 minutes. A gradual change or increase in the circle time. What reinforcers are we using, what activities are we doing, are they reinforcing for the student or the child, are some questions teachers or interventionists might want to consider. Also, creating a separate reinforcement schedule and a separate reinforcement strategy for each student always helps, because not all students are reinforced by the same items or activities. Student X may want bubbles, student Y may want rings to play with, student C may want a slinky or a uh, rubber toy to play with. So it is important for the teacher, therapist, or parent, whoever is working with the student, to identify individual reinforcer for each student and the schedule at which that this reinforcement has to be delivered. Uh, Once we have all these routines and everything is in place, we have decided what we are going to do. This is the sit time ratio, this is the circle time, and then we have to be consistent with our routine. We cannot be doing one thing on one day and the other thing on the other day. So to a certain amount, to a certain extent, in the sense optimum level of consistency in your routine is required for our students to get used to the activities and master those activities. Hence it is very important that consistency is maintained to an optimum level, and using very very simple language. Most of you are aware that all our students with autism have language deficits, and the if I speak to them the way I'm speaking to you, it is very challenging for them to understand all the aspects of your sentence. Hence using concise and simple language always helps to understand. Also, if that kind of language is maintained, in the sense I understand the importance of mother tongue, and it is very very important in any child's life. But if already our student has language deficits, is it right of us to expose student to more than one language is also something that we need to consider. So using one language for communication and using simple and concise language will always help. Now, the de-escalation strategies here on the slide, you can see that it is important that we provide more attention to the appropriate behavior or the positive behavior that the student is doing, rather than to the negative behaviors. So more attention and better attention for appropriate or socially significant behaviors, and no attention for negative or problem behaviors will always help reducing or de-escalating the problem behavior. Also, when the student is engaging in an appropriate behavior, it is important that we give a praise for the behavior that the student is engaging in. Let's say the student is sitting, we have to always focus on the behavior rather than just saying good boy or good girl. So general praise doesn't always specify what you are reinforcing and what you want to increase, because reinforcement by a definition works on increasing that behavior, right? So if your student is sitting currently and you want the student to continue sitting in the future, then it is important that we reinforce the actual behavior. So fact based praise, in the sense reinforcing or praising the behavior in question is very important, rather than giving a general general praise like, oh wow, well done. It's important to name the behavior when you're praising it or reinforcing it. Also, our kids need their space and time. So we have to give them space and time. We cannot always have them on the edge. So give them time and space. Teach waiting now. In a sense, it's a very important skill, and if you want to teach it later, you start teaching it now. That is the most important thing. uh, Also, the breaks that we give to our children need to be paired with some sort of cognitive distraction. It means that change in work is rest, that kind of stuff. So break doesn't always mean free time for doing nothing. Behavior momentum is another strategy that we use widely while de-escalating problem behaviors. In the sense, we transition from preferred activities to less preferred activities, or from simple activities to difficult activities. It always helps when you skip the hard ones and do the first simple ones first, and then slowly, gradually fade in the hard ones. Many a times we let the students preview the work of the day and work with a friend of their choice, so that they are able to uh, finish the work faster, or motivated to work with the friend. Many a times this decision making in students, and first decision making given to students while choosing their tasks and activities helps to complete the tasks better. We also provide reward choices, in the sense, okay, you want to work, but what do you want to work for? So that kind of choice making is also recommended. These are some additional strategies that we use here at the center. The MAN protocol will teaches students to ask for things, differential reinforcement of DRO, DRI, RIRD, and the walk protocol. These are some strategies that we use at the center in order to reduce problem behavior and to develop skills. So that brings us to the general guidelines that we follow while de-escalating problem behavior. It is very very important that we maintain constant communication with stakeholders and discuss the BIP thoroughly with all the team members. We conduct demonstrations on the strategies that we are recommending. In a sense, we do a role play, and consistent execution of these strategies across people and settings is the most important thing in actually bringing about reduction of problem behavior or de-escalation of problem behavior. And the last and not the least is staying calm and maintaining composure when actually the problem behavior is occurring. Because if we stay calm and maintain composure, we are able to think what to do, and we are able to guide the student or the child to do what is appropriate, rather than focusing on the negative behavior that the child is doing. So these are the guidelines that all of us may want to follow while de-escalating problem behaviors. That brings us to the end of the presentation. I will open the floor to Stephen, and I'll stop sharing the presentation.
Yeah, thank you, Ranjini, Michael, and Nilima for um, doing this vast topic in such a short time. I don't know if we do the justice, but I think we will engage with the audience with the questions. There will be there are questions which came to us in the beginning when we asked them to register. So I'll begin with those questions. So the first question, we don't have the name here. So they wanted to know that how do I know if my child has autism, as um, there is a speech delay and there is a hearing impaired cochlear implant, but delay in speech. They wanted to know how they can know about this particular diagnosis. Would Ranjini throw light on it?
Yeah. There's a speech delay. The speech delay can be attributed to the hearing impairment, but it always helps to go to a clinical psychologist, get the test done. There is an ASDQ. You can first do a screening test, or if the clinical psychologist recommends, a diagnostic test can be done, either the CARS or the ADOS. It's better to do these things early. It's better to get a diagnosis early, because the issue is not the diagnosis really, but what comes out of it. What comes out of it is a program that can be implemented, and you can see improvement in your child. You will know from once an assessment is done, you will know whether or not your child has autism, and based on that, future action can be taken. So I would suggest visit a clinical psychologist immediately, and if you are in Dubai, you can come to Al-Noor, because we have a psychology team which does assessment for external assessment as well.
The next question is about social support of children with autism. Someone wants to know the guidelines. Are there any specific guidelines, or probably something as an idea that would help to socially support the children with autism? I think the question goes, how do they integrate them into the society? Is that where the question is leading to? Because that's the only statement that I have here. Nilima?
Socially including the individuals with autism, I think it goes a long way from starting early. Once we have the required skills in place, we will have to start giving them experiences of these places where you want to include them. I think Ranjini will be able to help me on this better.
Yeah. So there are support groups in Dubai, several support groups. In fact, I can't think of any offhand, but if we can send you a list of support groups that are available, and there are support groups for children specifically. Specifically for individuals with autism, and they're very welcoming. You can become a part of these groups, and you will find that they have activities planned over weekends. They plan things so that the children can meet and play together, do activities together, and have fun together.
Yeah, so whoever I've asked the question, if they can just repost the question to the email that is given to the flyer, we'll be able to kind of guide you with those groups. And yeah, so the next question is more of behavior impacting the focus. So someone is asking about stimming behavior like flapping his hands, rubbing his body face down, how to make him focus in the class. So Michael, would you like to answer that?
Yeah, sure. Again, we would like to look at the function of the behavior. We just don't look at it by topography, but why is the child presenting this problem behavior? It's very important. We need to know the cause, and from there we could move on. We could, if we are able to identify that it's because of attention, then from there we will be able to look for a proper recording for the data. We are able to find strategies, and at the same time look for a replacement behavior on how to replace this behavior rather than just presenting this problem behavior. But when it comes to the focus, if it's more on escape, then we have two things there. We can either ask the child to request for frequent breaks and give him breaks and give a break from the task, or we can also maintain the demand or maintain the instruction to finish the task. There are a lot of things, most especially in Noor, that we do in order to increase the focus of the students in the classrooms. We have what we call proactive and reactive strategies. So when we say proactive strategies, these are strategies that we do even before the problem behavior occurs. This is our preventive measures. So when we look at increasing the attention of the student, we would look at visual schedule. Because if the student knows what's going to happen next, then the more he's motivated to do it. Most especially if a difficult task is followed by a break. Therefore, he's more motivated that, oh, once I finish this, I'm going to get a break. So might as well finish it as fast as I can. There are also a lot of things such as pairing. Or when I say pairing, this is associating yourself or the instructional materials with something that is interesting or enjoying or rewarding for the student. We try to make activities enjoying so that we get the attention of the students, and many more. We do a lot of things here in Noor, but apart from that, we also have what we call reactive measures. So these are the measures that we do once the problem behavior has occurred. The boat has already sailed. So we have what we call escape extinction protocol, wherein we widely use here in the school as well, wherein we maintain the demand. It's a very systematic and step-by-step procedure. So those are just few things that we do here, and there's lots more.
Yeah, I think there are many questions about behavior, kind of coming in the way of learning, like how to handle temper tantrums, emotional meltdown during adolescence. These are very pertinent questions which we come across. So also, as Michael mentioned about the functions of behavior, everything is originating from somewhere. So are there any specific kind of strategies that you would like to mention about temper tantrums? Because in adolescence that becomes quite a challenge. Ranjini?
Michael?
I think we'll make a behavior analyst out of you, Stephen. Using all the right terms. The thing about adolescence is a time when, again, like Michael had mentioned, and so had Nilima, we have to look at the function of the behavior. Either it is very often, it's a case of the avoidance or of wanting something tangible. So it's basically the parent here will have to find out what it is. It is basically to do with the function of the behavior, and a history of receiving the consequence of their choice for that behavior. So, so basically, that's what needs to be addressed, right, Michael?
Yes, ma'am.
Yeah.
When it comes to, let me just add on it, that when it comes to adolescents, we also want to, since I got the opportunity to work with adults here in Noor, based on my experience, I would largely consider as well the stage wherein they're becoming adults. So there are a lot of biological or physiological changes happening there. So there would be for ladies, there would be menstruation, and I have few students who who presents problem behaviors related to menstruation. So we have to look at those, and we'll use it as a setting event apart from the antecedent and the consequence. We can use it as a setting event that could we can actually use to also try to create a behavior intervention plan.
Thank you. Thank you. Then we have another question. Someone wants to, I mean, if you can briefly tell us about the causes of autism. There's a question that has come in the pre-registration questionnaire. So one of you, if you can please show a few instances of the causes.
Who wants to take it? It's basically a neurodevelopmental disorder. The causes are largely unknown, but there is a genetic basis. Studies. I mean, autism is like an ocean. You know, there are studies and more studies that that reveal newer. The newer studies reveal more causes for autism. There is a genetic basis for it, but would anybody else like to add to what I said?
So basically what I feel is that there is no single cause as such for autism. It can be multiple causes put together, or one or two at the same time. Though, as Ranjini says, from the studies or from the literature, it has been seen that genetic disposition or some sort of genetic basis of is there present in autism. But many times we have seen that neonatal trauma is another cause, which is largely associated with, in general, developmental disabilities.
And also there are some syndromes. These syndromes, children who have these genetic syndromes may have a greater predisposition for autism, like Fragile X is one of them.
Yes.
So you will find a greater population of individuals with Fragile X having a comorbid diagnosis of autism as well.
So also another question is that role of physical intervention and positive handling techniques, your views on that. Someone is asking about the physical intervention and positive handling techniques. So though it's not very clear, but they're talking about, are there any physical intervention, maybe a gross motor activity, or reinforcement? I think it's the positive handling technique. That's what they're talking about.
Yeah, so
Michael,
basically, sorry. Yeah,
is it the positive behavior support? It's probably the positive behavior support.
Maybe positive behavior support.
Yeah, so as far as physical activity or physical, we use physical prompt when needed, or physical guidance when needed, but there is no physical intervention as such that is done. In a sense, prompts are used to teach a skill or to help the student acquire a skill, and they are faded as early as possible. And the positive behavioral support in terms of reinforcement or in terms of pairing, wherein teaching is try to be made fun, so that the student himself or herself is willingly learning things. If that kind of environment is present, I think that would amount to positive behavioral support. I don't know if I've answered that question.
Yeah.
And also, positive behavior support is more a school-wide approach that is used, where there are a lot of do's that are put up on all the walls of the center of the school, and you get rewarded. You collect points. You get rewards. There are rewards for complying to the school rules, which are pasted all over the walls of the school, and to follow a certain code that the school has set out. And this reward system ensures that the students stay, they comply with learning, with following the rules of a school. It does work. What happens is it is used. This particular, if you look at the school population as a triangle, you'd find a majority of the students in the lower part of the triangle will fall into this category, where they follow the rules as are laid out in the different areas of the school. Whereas there is the tip of the triangle where there are children with severe problem behaviors, where ABA comes in, and then they have behavior intervention plans, and they work with those plans. So yeah, if you look at it, if that is what you meant, it does work. Positive behavior support would work, but it's an approach that has to be adopted by a school.
Yeah. Thank you, Ranjini. We have a question from Dr. Francis from Zambia about the steps of de-escalating the problem behavior, specifically in youth and persons with disability. I think Nilima has spoken about that, and the question came before your slide, I think. So would you like to quickly give those pointers to Dr. Francis?
For me, Michael? For me or Michael? What are you saying?
For Nilima. For Nilima.
Yeah. So de-escalation, are we going to send this presentation across to the attendees?
We are going to send
Yeah, so Dr. Francis, thank you for question. So what I would suggest is, as we have reiterated time and again, the de-escalation strategy that we use will largely depend upon the function of the behavior. But yes, some general guidelines which I have already listed, and some specific ways in which we can modify our behavior, change our behavior, modify the environment so as the occurrence of the behavior, problem behavior does not occur. Can be used to de-escalate the problem behavior. But specifically, if you are asking, I think largely it will depend upon the function of the problem behavior.
Can I add something to that as well? Yeah. So whenever we look at managing problem behaviors or behavior reductions, the programs are always tailored based on the needs of the student. It can't be a general one or a cookie cutter or one size fits all. So some students, one modality could be effective for one student, and this modality might not be effective for another. So we need to look at that. And here in Noor, we make sure that everything is tailored according to the needs of the student.
Yeah. Also continuing with, what is the best way for teachers to help parents de-escalate the problem behavior occurring at home? It's a very common concern. Most of the teachers are being addressed by the parents. So are there any specific answers to April, Nina, who is asking this question? Michael, would you like to take this?
I'm sorry, I'm Stephen. I did not get the question. Can you repeat it?
The best way for teachers to help parents to de-escalate a problem behavior occurring at home.
Yeah. So when it comes to de-escalating problem behaviors at home, it is very important that we get the parents on board first and foremost. So we all know that this is students, have spent their time at home more than in school. That is why it's very important that parents are on board. At the same time, practitioners or the team members needs to transfer all the interventions that has been done from class across settings. Apart from that, I think training is very important, because I have seen it from what we have here in Noor, such as like parent and child training, wherein we we train the parents on the principles of applied behavior analysis, it does miracles when it comes to supporting the child in a home setting. So it would be good if we get the full full cooperation of the parents first and foremost, and from there we could start giving them training and imparting them how to execute each of the behavior intervention plans, and how to try to maintain these schools for a longer time, because we're looking at not only for a specific year, but we are looking at improving the quality of life of that person for a longer time.
Also, there is a question from Hanan Hashem. Who should do these descriptive assessments? I'm not very clear about which assessment Hanan is talking about, but if anyone like to take it from there.
Anyone who works with the student can do descriptive assessments. It's more on just narrating what happens right before the behavior and what happens right after the behavior. So the only point that I would like to request when you fill out this kind of assessments would be that you need to be the report should be complete, objective, and clear, so that we get the right picture of what the problem behavior is and what causes the problem behavior.
Yeah. The next question is a bit tricky. I mean, I don't know if we have time to answer that. Is discrete trial training a part of ABA? And if yes, what's the major difference between ABA and DTT? Nilima,
Yeah, it is a part of ABA. It's a strategy that is used. DTT is a big part of ABA, I think. And the discrete trial training is a methodology that we use while teaching new skills. And DTT is a very important component of ABA. They are not different. I mean, DTT, ABA encompasses DTT.
Yeah. Think of ABA as a big umbrella, and under it is DTT. So DTT actually uses the principles of ABA. So when we say ABA, I have mentioned a while ago, we use the principles of applied behavior analysis, which are reinforcement, punishment, motivation, and and all of those stuff. And we use that also in DTT. So DTT uses the principles of ABA.
But again, very clearly, you have to. Many people think that they're synonymous, DTT and ABA. Not at all.
But that's what I would like to add. Sorry. I would like to add as that DTT is not the only part of ABA. We do a lot of natural environment training. In the sense, everything cannot be taught at a table. So some skills are needed to be taught in the environment that they are occurring. So DTT is a very important part of ABA, but that's not what we do only.
I hope Rajesh has the answer. And moving to the next question, how to help them during this time? I think the questioner Nidhi is asking about how to help that particular child or that particular individual when he's going through a meltdown. Would you like to, Michael, would you like to say that?
Yeah, sure. So whenever we look at de-escalating, we need to look at the function of the behavior. Otherwise, we might just add to the injury. So if you are there as a support, you might want to quickly ask the ABCs of the behavior, so that you can, because once you are able to identify the function of the behavior, then everything follows. So we would like to consider in priority the safety of the student during meltdowns or during challenging behaviors. So we might need to employ different safeguarding tools, such as helmet or padded sleeves, or just make sure that when you execute any behavior intervention plans or any strategies, the safety of the student is the #1 priority. So even if you would like, even if the function of the behavior is attention and you would want to ignore the attention, we would still safeguard the student and block him from injuring himself. Nilima, please go on.
Yeah, so that's what do no harm is the first focus that we have generally in while working with the students. And second is, as in the general guidelines, which I had said, that most of the times what we have observed is that when the student is engaged in a meltdown or a tantrum, especially in a community, uh, uh, many interventionists also go haywire, that oh my god, what is happening. So the first important part is we have to stay calm and remain composed, and it doesn't come easy. It needs practice and it needs training, and you need to work on it, that whatever happens I will stay calm. And in such certain cases when the tantrum is actually occurring, rather than focusing on what, or rather than telling the student don't do this, don't do this, don't do this, don't do x, don't do y, rather than that, if we are able to tell the student, if attention is not the function, do what instead. Okay, the student is rolling on the floor, instead of that, what do you want the student to do? Stand up and walk with me, something like that. So basically redirect the student to an appropriate behavior, and remain calm and composed, and walk the student through the tantrum. That always helps. Of course, function of the behavior is always the basis.
Yeah, thank you. Just two questions again from Dr. Francis. He wants to know about the symptoms of autism and spastics, and then how do we assess disabled persons who suffer or who have autism in Al-Noor. So Ranjini, you would like to answer this?
Yeah, so in Al-Noor, we have a team. We have a department of psychology. We have a very qualified and experienced senior clinical psychologist at Al-Noor who does basically these things. We use CARS, the Childhood Autism Rating Scale, CARS 2, to assess our students on whether they have autism or not. That's what we do here.
Yeah.
But every student who comes in for first comes into the center during case intake, we administer the ASDQ, which is a questionnaire we administer to the parent, and then if the child has symptoms of all the symptoms get red flagged there in that when the parent answers that questionnaire, and based on that we decide whether or not they can do the assessment using CARS 2. So that's what we do at Al-Noor.
Yeah. Another question is more, I think it's a parent, Nisan Salah. My son is more of a prompt dependency, as well as he doesn't show his ability even if he can escape, for escape behavior. My need and focus nowadays is for me to escape from giving prompts and taking him out of the prompt dependency. Please suggest an advice. Yeah. Would one of you like to take the question?
I think we have to consider largely the motivation of the students. Yeah, sometimes we misinterpret and we look at it as prompt dependence, where in fact it's actually some kind of escape behaviors, because when they don't want to do something, they just seem to just don't work. Hence, we are issuing the most effective prompts. But sometimes this is leading to an escape behavior. So it's better that we exhaust a lot of proactive measures on how to increase the motivation of the student. Again, we have to pair first before we even give demands. We have to pair ourselves and pair the instructional environment with something rewarding, something interesting for the child, and then from there we could gradually incorporate demands or tasks, and then from there on we could see some improvements when it comes to independence. So we need to look at the root rather than just trying to blindly solve something that we're not even looking at the base.
Yeah, thank you, Michael. The next question is, are you offering ABT training? Ranjini, can you just reply to that question?
Yeah, we are in the process of working towards, very shortly we'll come up with our RBT training program.
And the next question is about, I'm just going quickly because we have exceeded the time. Can you guide me how to stop the child who is hyper using his hands? Like probably it is talking about a physical aggression, which is the problem behavior. Are there any responses to this question?
Which problem behavior, Stephen?
I think it's physical aggression using
okay,
his
because
hands.
if it's hyperactivity, then we need to channelize it into something functional. Maybe we have a lot of students who are hyperactive or who has a lot of energy, and we don't want to suppress that. We would want to channelize that to something that is functional rather than suppressing it. It's gonna be there, yeah. But when it comes to aggressive or self-injurious behavior, that would be another issue. Then we would need to look at again the function of the behavior. Apart from that, again, I have mentioned this earlier that the safety of the student is our priority. So we need to employ tools which can safeguard them or safeguard other people around them as well.
Yeah, a couple of questions, whether we'll be sending the presentation. We will be sending the presentation to all the registered people. The next question is by Jamaica. Why do you think stimming behavior is occurring? My student is doing this every time, even though I'm giving reinforcers and having fun activities, for example, art and craft, which my student really like. So, yeah, one of you would like to take this. Nilima, you would like to answer that?
Yes. So stimming, it will be very important again to do the ABC for the stimming. So when does the stimming occur? That will help us to ascertain the function of stimming. Is it completely only self-stimulatory, or is there any associated function along with the self-stimulatory function? Many a times, if it is self-stimulatory, I think it is important we engage the student as much as possible in activities which are not stimming and are constructive and are teaching new skills. But 100% of the times, if it is the function is totally self-stimulatory, I will not recommend completely blocking the stimming at all times, because all of us as individuals have some sort of stimming. Like I may be sitting and I may be doing this, that is also stimming in a way. So it will depend on whether it is harmful, whether it is because the student wants to escape the task, or because he or she is asking for attention. Then we will have to develop ways of seeking attention properly, seeking escape from tasks properly, and then we can move forward from that. So basically ascertaining the function of, though it may seem like a self-stimulatory behavior, many a times the self-stimulatory behaviors serve a different function also. So I think that again we come back. I think you all are going to say that whatever you ask them, they come back to function of the behavior. So, but I think that's what we have to do. Ascertain the function, and if it is self-stimulatory, I think engagement of the student as much as possible into skill acquisition and reduction. So that there is less time available for stimming or developing other self-stimulatory activities for the student. So rather than the the spinning or the flapping of hands, if the student develops some other leisure activities or something else that is appropriate, so-called socially significant and appropriate, then it will help, I think.
Thank you, Nilima. There's another question which is more practical, I would say. The strategies used in the center of control in controlled environment, but working as an LSA in the environment in a school is different. Can you guide accordingly how to de-escalate a problem? The same question is asked, one more question is asked by this person, Bhavna Goel. Attention seeking, if you don't give attention, other kids are there to give attention. I mean, it's a very complex scenario where this person is
Peer
coming from.
attention.
Yeah. So, yeah, would you like to answer, Michael, about an LSA asking how do you control this in an environment in regular class?
Yeah. we have to keep in mind that these students learn differently as well. So as much as possible, let us accommodate for learning. Okay, if they are not adapting with a large group, then we have to review our intervention or our program. There are some students who are ready for a large group, but there are also students who might need a one-on-one attention. So a good assessment data would give you a better way on how to address behaviors. One student might not be fit for a classroom. But that's just one idea or proactive measure on how we could actually avoid this kind of problem behaviors in the classroom. But when the problem behavior is already there, most especially in a classroom, I usually use a lot of a dense reinforcement schedule, a lot of pairing, a lot of delivery of breaks, and then from there we gradually increase or incorporate more demands.
Thank you. We have many questions here. I would like to take a few more before we close, and we'll answer each question by an email. Could you explain cognitive distraction clearly? Is the question by Soumya Chandra.
Yeah. So, yeah. Please, Ranjini, go ahead. No, it's okay. You go ahead.
I mean, I think the easiest explanation is texting while driving. That would. Yeah, you go ahead, Nilima.
Yeah. Cognitive, Soumya, are you from India? I guess you are from India. So basically, that's what my grandmom used to tell me, that when you want rest, you change work. So if you're tired of folding clothes, go and wash dishes. Something like that. So what I'm trying to tell you is that we don't have to do this. This is just a literal meaning of it. Break is, yes, it means free time, but it is break from an activity that you are currently doing. If I was doing a puzzle and I completed the puzzle and now I'm on a break, I might go and swing. Yeah, or I might go and listen to music, or I might go and maybe cycle for a while, come back and then complete my assignments, something like that. So what I'm trying to say is that cognitive distraction means it distracts you, or the break is from the current activity, but you are engaged constructively into doing something else, rather than just having free time, and then time is free for stimming, spinning, or whatever, mouthing inedible objects, or all these things. So basically engaging them slightly differently from what currently you were doing would mean cognitively distracting. Have I answered your question? Stephen?
We'll get back to this question.
Yeah.
If it's not answered, we'll answer the email. Now the question is for Ranjini. Now that we are in the pandemic, what programs do you can offer in intervention for kids having ASD? Ranjini would have a lot of answer for that. They're looking at how do we support children in pandemic.
In fact, since March onwards, we started what we call the distance rehabilitation program. So everything went online. We were on a virtual platform. We were using Zoom. That's when we started using Zoom at Noor, and we are continuing to do so. At the moment, some of our students are coming into the center, while some are still following the distance rehabilitation program. What happens is these programs are individualized sessions. There are a group of individualized sessions provided by different therapists and teachers to the students. So the day for the student, the school day is planned in slots of half an hour each, where each interventionist has a session with the student. More often than not, these sessions are parent mediated, which means the instruction is being given by the instructor from Noor at one end, and the parent is with the child following that instructions and working with the child. what we have found, especially for children with autism, what we have found is, in the past, we would have demo sessions where parents would come to the center and learn from us how to work with their children. Here, we have entered the living rooms of our children, and in the living rooms of our children, we have seen how the parents are interacting with their children, how they are working with their children. We have been able to plan the routines of their children. We have been able to plan the activities with the materials found at home. And the best of all, the takeaway from this is that we have trained these parents for life. These parents have gone away with skills. Now they have these skills with which they are able to ensure instruction control. They are able to follow the program like we would want them to follow the program that is given. If there is a problem behavior, they are able to work on de-escalation of the problem behaviors. Now they have the tools with them, and they are for many of those skills, they are no longer reliant on us. They're able to do these independently. So have I answered, or is there anything more?
Yeah, if we have answered, if you know more clarity, you can email us so that we can reach back to you by email. A couple of parent questions that I want to kind of look at here also are there that the child is talking and laughing whenever he's not occupied, even after continues to stop, it's not decreasing. Please suggest. There are, I mean, like, I think the question and answer is mixed here. I mean, you know, whenever he's not occupied. So you mentioned about, you know, engaging. Michael, would you like to, you know, have a quick rebut on that?
Yeah, sure. Usually, these stereotypic behaviors happen when the student is idle. So, give them structured routine or structured schedule, structured activities, and try to increase their activities. The more that they are idle, the more that they will engage in these stereotypic behaviors. So make sure that downtime is very less, while functional activities are more.
Yeah, there are questions that how much is the fee at Noor, and you know what are the options that we have for children who cannot afford their fees? Would Ranjini like to answer that question?
Fees, if you leave your email IDs, we can send you the whole, we can send you a flyer, and we can send you more details. So please leave your email ID in the chat box, Stephen.
Yeah, in the chat box, or yeah, please in the chat box. Yeah, another question is, can diet have a positive and negative effect on behavior in children with ASD? Diet and its relation to the behavior. Michael.
For the diet, it depends what kind of diet. So we are also looking at a lot of things here. So I'm not an expert when it comes to diet, but based on my experience, of course, it affects the body physiologically. So if they have undereaten, that would be a setting event for me to expect for problem behavior, because there would be like a higher motivation for food, then therefore there might be a lot of opportunities for them to present problem behaviors related to the food, and that's undereating. When it comes to, I have heard about sugar. So those that would sugar or chocolates or anything sweet, that might increase their hyperactivity. The main point here is that we know how to channelize, or how to manage, how to channelize this behavior into something functional. When they're hyperactive, maybe during those times we could give a lot of physical activities rather than just a table and chair activities. When they are, they have undereaten, or they did not have meals for breakfast, then might as well, either you give breakfast first before you even start the day, or you could expect for problem behaviors during the day.
Okay, and there is another question from Wendy, who was asked the previous question. What type of token economy works for students with ASD? Are there any specific economies that you want to put
So,
light on?
when the token economy in actually means is that we have two sets of reinforcers. So we give a token reinforcer and then the tokens are exchanged to get a backup reinforcer. So basically you will have to identify what is most reinforcing. It is not the same for every student. So you will have to identify a reinforcer for each student, and then you will have to identify tokens. So for some students, the tokens used can be stars. For some students, then they can be coins. Or for some students, they can be other items. And then for token economy also, we decide a schedule that you get as many tokens. Let's say a student has to get 5 tokens, and then he exchanges those 5 tokens for a time on swing, something like that. So token economy works in a conjunction with a backup reinforcer. There's a token and there is a backup reinforcer. The two have to go together. So the student, I mean, the interventionist who is working with the child, a student, needs to identify a backup reinforcer for which the tokens will be exchanged.
Yeah.
Also, the other question is that, is there a link between mental illness or physical illness with a person who has autism based on their lifestyle in the long run? Do you have any comment on that, Ranjini?
Um, I mean, we do see that in some cases, I won't say all, we do see, because we do see many adults, there is an incidence of mental illness during adulthood. But I don't think I'm qualified enough to talk about it. I can only say that I have seen the prevalence and
Thank you.
yes.
Yeah, so I mean, someone, Mini Nair is asking about ABA courses. Our team would get back to you with the courses that you can consider doing it. The other question again, I would like to put it to Ranjini, that is it possible for people with autism or individuals with autism to lead a everyday life independently when they become an adult? Ranjini, can you please throw light on this question?
Of course, it depends upon the training. They can live independently. We need to start young. Like I mentioned to you that we at Al Noor follow a lifespan approach. That's what we mean. We would like to eventually ensure integration, inclusion into the real world and independent living.
Yeah.
It is possible. Yeah.
Yeah. And then there's another very, what do you call it as current question. How can we manage the anxieties related to COVID and people with individuals with autism? So there are many discussions that we had also in our team. So one of you, would you like to answer that? How to manage anxiety, which is COVID related?
Yeah.
Ranjini,
I'll just
Michael.
give an insight on how I manage because I get the same questions from my parents as well. I mean from my clients, most especially those clients who are in distance rehabilitation program. So I try to suggest them to incorporate the things they are doing outside or outdoors in their own homes, in the comfort of their homes. So if before they are able to go to the playground, why not make your own playground at home? You can do like themes every day or themes every week, so that you don't feel like you are just there at home. Because definitely one way or the other, they're gonna just repeat the routines they're doing. At least make something different during the days. So I would highly suggest having themes during the days, which makes something new.
Yeah, I would like to add to what Michael said because, as he said, during the distance rehabilitation programs that we had parents who prepared obstacle races using pillows and tables and sofa sets and whatever.
Exactly.
So it was for us to suggest that you can do this, but parents were very innovative. So they found activities because I had a student whose mother decided that since there are no objects, she just started using potatoes and onions for transferring objects. So we can find out activities staying at home, and as he said, we can do activities that we were doing outdoors. If we are able to in certain way bring them outdoors, then I think it will help in reducing the anxiety.
So would actually, I mean, would we have few more questions to answer? I would actually choose to reply through an email because we've overshot the time too much. But I would like to thank you all for joining us. It was wonderful engaging with you, and I know that there were some parent very pertinent questions that we were able to answer. There are still to be answered, and it's a topic that can never end in 1.5 hours. We will
Yeah.
come back. Yeah. So we would in fact come back to you. We will have series of workshop based on your questions that where the need is coming from. I would like to thank Ranjini, Neelima, and Michael for their patience and their expertise to be shared with us. And I would like to thank the audience who were patient enough to be with us. There were many in the beginning, but I think we had quite an engaging session. It goes by the chat and the question answers. So thank you once again, and see you again.
See you. See you.
Thank you,
Thank you so
everyone.
much. Thank you,
Thank
everybody.
you.
Bye.
Yeah, we'll be winding up the session, so we'll be closing the session so that we'll be reaching you all with those who have submitted the questions, and we will send you the feedback. Thank you once again, and have a good day and week ahead. Thank you.